Happy Friday, everyone. And thank you so much for being part of our catch up today, this Zoom meeting. And it's been lovely to see how many friends are here, but also how many new people are as well. We've got people from all over Australia. We've got at least one from the Philippines. So it's great to see you all there. We're going to be talking today about how we can train managers to lead mentally healthy teams, and in particular about how we can scale it and increase the chance. This webinar topic came from when I shared about 2 months ago this on LinkedIn. And I'm pretty active on LinkedIn. I often get quite a few, quite a bit of engagement, but this was just like nothing else I've seen. So we got 2.7 million people read it, over 4,700 shared it, and 1,100 commented. And 95% was that the best way to boost employee well-being was to give them better managers. So this will be the theme we'll be working on. For those of you that don't know me, I'm a team care resilience author and speaker. I'm also an author of a number of books down there about Back from the Brink, and I've had my own real lived experience with severe depression. I was also a founding board director of Are You OK? And it's been wonderful to see how that's grown in reach and impact. And 5 years ago, I co-founded WeCare 365 with a real e-learning guru called Brendan Carter. And we'll be discussing some of those things today. Some of you have been kind enough to submit some questions, and we will definitely get to those questions at the end of the session. I also would just let you know, for those of you that don't know, is that we also have the Caring CEO podcast. This is a podcast where we interview CEOs and senior leaders that champion both a culture of care and a culture of high performance. And we've got a full range of amazing leaders, humble leaders that are achieving great results. And we really hope that this shows what we're talking about isn't theory, but it's actually people being successful in practice in making this happen. We offered in the initial promotion that we would let the first 5 people that registered get a free access to WeCare Manager. So we'll be coming back to you. Jenny, who's on with me, who's our operations manager. So the people that were the first 5 are Joe Horton from MedAdvisor, Malcolm Anderson, there you go, lucky, Jim Kelly, who's from Safe Work New South Wales, Louise Judge from Chinchilla Community Centre, and Melissa Logan from the Gidget Foundation. So we will let you have a copy of that, of this WeCare Manager program when we finish. So what's the why? Well, as I said, that LinkedIn post gave me an example of a huge why. It just really resonated around the world that good managers produce good team and good employee mental health. But there's also some pretty other solid reasons. You may be aware that there's been much more robust psychological safety and health legislation passed in the majority of states and territories and around Australia. And I think the big change in this is that it's not just about, creating a good environment, and of course that's something, but it's about understanding the root causes of what's causing your people stress and burnout. And this is what Narelle Beer from WorkSafe Victoria, just because a mental injury you can't see it doesn't mean it can't be prevented. And there are really good surveys out there. There's a number of surveys that allow you to understand what are the root causes of the issues that your people have. We'll send a copy of this video to you. This was a 6-minute interview I did just talking about the new laws coming in and why they change everything. It's, it used to always be that, of course, if we provide mentally healthy workplaces, It's better for productivity. But if we don't do it, we leave ourselves at risk and open to prosecution. We at WeCare 365 work with the Next Step, who are a large HR recruitment company, and the Safe Step, a large work health safety company, and interviewed the mood of the Australian workplaces. And what we found out was that on average, we came in at 59%, 59 out of 100, but there was still 34% that were 50 or below. 50 or below. So you can see that poor mental health is a significant issue across our workplaces. And there's been so many challenges that have contributed to that. We've had the COVID lockdown. Our poor friends in Melbourne went through the longest lockdown around the world, but it's also changed work profoundly. Many industries were severely affected, like the hospitality, the travel, the events industry, the restaurant industry. But they've also changed all our workplaces. They've made, virtual work much more common, hybrid work much more common. This was something quite staggering, that only 8% of organizations rated themselves as very good at monitoring and costing the factors that indicate poor mental health. So this was 461 HR and work health safety professionals. Only 8% said they do it well. We can't manage what we don't measure. And this does really signify a clear and present danger to organizations. 40% rated themselves as being poor at measuring these poor mental health barometers. 1 in 4 don't regularly discuss improving workplace mental health. 1 in 4 C-suite. And probably even more alarmingly, that only 18% were very committed. Only 18% were very committed. And stigma is still a massive, massive issue. I'm going to be posting a bit later on today about why leaders should be posting about their own mental health struggles. And I have been fortunate to interview a number of leaders for the Caring CEO podcast, where they have nominated, they've had struggles. I've had Emma Hogan from the Secretary for the New South Wales Department of Customer Service, has talked about her own mental health struggles. Jo Skipper, who became Managing Director of the Safe Step, talks about when she became, got an anxiety attack after becoming the Managing Director of that business. I've also had another leader, I've been in the room with another leader, he led a group of 6,000 people, talked about a time when he was homeless and living in a car. So what that does, it does reduce stigma. It does create greater trust and respect and vulnerability. Now, we need to carefully consider how we do that and the way to do it. And in that LinkedIn post today, I will be sharing a great resource I found that helps leaders to do that and to share that message. 44% of managers don't know how to build mentally healthy teams, so close to 50%, quite extraordinary. We're going to go into some breakout groups, and we'll go into breakout groups of about 4. And I want you to really think about these questions. You might just write them down. How ready is your manager for this new environment? Do they know how to build a mentally healthy team? Can they be vulnerable? Can they build trust and respect? And then I'd like you to share an example of what you're aware in your workplace where someone has done something really positive to break down that stigma and show some vulnerability, but to also help trust. And so we'll have a couple of examples around that. And Jenny will put you all into groups of 4. And when you get into that group, I would just ask that, you nominate a leader who will report back to us about, the answers the group came up. So that's task number 1, is to do that. And just note down these questions that you are to discuss there. And Jenny will start putting you into the groups. You'll have 5 minutes to talk about this, about how ready is your manager, and what's an example of something a manager or someone you know has done well, and what have you seen as a positive way to reduce stigma in your workplace. So they're the 3 things. We want to tap into your experience and wisdom. So we'll put you into the groups now for 5 minutes. Have a good chat. Excellent. We've got everyone back now, and yeah, I'm sorry there wasn't enough notification. It was about to end, and but it'd be good if we could get a couple of groups. And so, in I think it was room 1, we had Ange, Caroline, Malcolm, and Natalie. I think Natalie might have come in late. So, is someone from that group able to just share and summarise, what you discussed there?
Sure. We had a discussion about the impact of COVID and lockdown, and how that really brought to the forefront of many people's awareness the impact on mental health and well-being. And prior to going through lockdown, it wasn't really necessarily something that was front of mind for managers. It wasn't something that they were particularly skilled in discussing, but that whole couple of years of being in lockdown has really sort of forced managers to face the impact on mental health and to start to have those discussions. And some people managed to make that transition and did that really well, and others struggled a bit with it. But I think that one of the outcomes is that it is now much more front of mind for many, and those conversations occur more often than they have done in the past.
Great. And Caroline, was there anything done to reduce stigma? Did you do anything to try and make the conversation easier?
So we did do a few things. We ran We Care training for all of the people within our business, and we put in place some what we call We Care ambassadors, who were designed to help raise the flag if they observed someone that they felt wasn't coping and might need a little bit of support. That was probably the biggest thing that we did within the organisation. Our leader is very good at, he's very conscious about mental health and well-being, and so he leads very well in that space, and often has discussions about mental health and the impact of things that might be going on in our business on mental health and well-being.
Yeah, and I actually, Caroline's CEO is Chris Murray, and I've interviewed him on the Caring CEO. And, he talks about tragically losing 3 male friends to suicide. And those sort of stories do make a big difference. We might jump to room 4. So that was with, thanks very much for that, Caroline. But in room 4, we had Kate, Kelly, Nayeli, Rebecca, and Robin. Have you got a spokesperson from that group, please?
I think Kate should go for it.
Good idea, Kate.
All right. Yeah, so we found that having like a mental health day or days throughout the year offered to staff was something that really helped, where they could they called it different names for things, but it was the mental health, it was like 4 days a year or 3 days a year that staff can use as and when. It doesn't accumulate as such, but if they need it, it's there throughout the year, and it's paid. And that's been something that staff have really valued in my business too. And then the other thing we were talking about is like having like a questionnaire or something where you can kind of have a check-in with your staff around their mental health. That's one of the members was talking about that we didn't get to finish. And then the other thing that I've been doing with my team, I came up with this idea of how do I check in on them holistically without it going into a whole meeting for hours on end about everyone and what they're going through. So I came up with this holistic way of doing it, which was every Monday we check in for 15 minutes as a team. I'm only a small team, but and we just go around the group and we say, what are you doing for your mind, body, and soul this week? And then they all have to say things they're doing. And one of them, she's like in her 20s and she's never thought about her mental health. So she's like, oh, this is weird. And then I've got another lady who's in her 40s and she's like, oh, I've never even prioritized this kind of well-being. So it's been quite a challenge for them to think of things that they're going to do, right? But it makes them be preventative and proactive rather than reactive. And then after they share what they're going to do, we all kind of keep each other accountable. Like if we say we're going to do a gym class, or we say we're going to listen to a podcast, we like check in that we've done it, you know, and then or encourage each other to do it throughout the week. And then afterwards, I'll say, out of 10, how are you doing with your mental health? So they'll either say, you know, if they're usually an 8 out of 10, I'm not too worried. But if they'll say a 6 out of 10 one week, I'm like, okay, I'll check in with them later. Or you could have someone in your team that checks in on them, their team leader, or someone that's just, hey, you're a bit lower this week. Is everything okay? And that way, it's not like them having to share if they don't want to, but in the public forum. But at least you know where their head's at, so you know whether you want to apply pressure that week or not over a project or something. You might want to ease off a little bit.
Yeah, that's great.
So it's just about a kind of a way to check in without it getting too personal.
Yeah, some of you that are familiar with my work would know that I talk a lot about a moodometer, you know, green, amber, and red. It could be 0 to 10.
Oh, yeah.
But it can be a very, very, you know, a great tool. You know, I know people just ask whether they're, you know, in the green zone or the amber zone, and they leave out the red because they think someone's may not want to, you know, share that. But if they're in the amber zone, it is a red flag as well. So, yeah, that's a really great idea. Well done. And maybe just have one more, room 3, which had Mo there and Nat and Emma and Bill, a spokesperson for that group.
I'm going to step in just by default. Not appointed, but otherwise pleased to share the very brief conversation that our team had, and that was really just predicated through introductions of who we are and the space that we occupy in. But what I'd like to propose, given that a couple of members in that group are mental health first aid trainers, another one, and that was Emma, was in a startup as I am, and so we're possibly facing different challenges. Is to throw it out that obviously frontline managers and execs in particular are so important in this conversation, and their EQ and understanding of the importance of workplace mental health and well-being. But I think underpinning it is, as we're potentially looking at systems and codes of practice and data collection, et cetera, how engaging are we with the workforce itself in obtaining a lens on, as you alluded to there, Graham, their mood of being, of mental health and well-being, and as we're collecting that, how are we integrating that into the overall, I suppose, structure of putting into play a safe, mentally healthy and well workplace. So we didn't actually get down into any of the reads itself and strategies, but that is definitely conversations that I'm having with multiple corporates at the present moment. And would love to, possibly take that through as a bit of a theme.
Great. Thanks, Mo. Thanks, everyone.
Thanks, Ray.
If we didn't have time for people to, share ideas about what's been done to reduce stigma, please feel free to put that in the chat. But I'll now move on to, I guess, the rest of the presentation. So these are, of course, these are, some other examples of why this is really, really important, that mental health is now the number one societal issue that employees care about.
Graham, we're just seeing the presenter screen.
Oh, it hasn't gone back. Let me just fix it up. Okay. Hopefully we're right this time. There we go. Is that okay now?
We're actually seeing the PowerPoint, Graham. Getting there, getting closer.
That it?
Yes, got it.
Oh, so yeah, this is a report by PwC and Atlassian, which found out that mental health is the number one issues that employees care about. That if a company is seen as doing something substantial to address the mental health in their organization and also in the general community, the engagement lifts dramatically from 54% to 89%. And it also showed that 69% would turn in a promotion to preserve their mental health. This isn't just about health and well-being, it's about productivity as well. And Microsoft did this study, which looked at what are the critical success factors for successful hybrid work? And it came up with these were the top three: positive culture, number two, mental health, and number three, a sense of purpose. And I would suggest that a positive culture is a mentally healthy and psychologically safe culture. This was, their results on measuring the Australians' robustness, and they showed that 62% of employees and 66% of managers were feeling burnt out. They haven't done an updated number this year, but it's a very big number, isn't it? This was a study done and published in Lancet Psychiatry, which shows that basic mental health training for managers can lead to almost a tenfold return on investment. So for every $1 you spend on it, it brings back $10 in reduced absenteeism, stress leave, etc. So in addition to the risk we talked about for not doing it, there's also the real upside. The World Health Organization came out last year and said for the first time they recommend managers know and build their capacity to prevent stress and to respond to workers who are struggling. And they also identified that mental health issues in the workplace globally cost $1 trillion. $1 trillion. And I don't think we can ever really grasp what $1 trillion are, but I found this visual which gives you a good idea. So these are stacking up $100 notes, one on top of another. So for 1 million, it would just be 3 feet. For 1 billion, it would be 1 kilometer. But for 1 trillion, it's 1,000 kilometers high, much higher than a space station. So the other thing that came out was the World Health Organization said they expect that this will grow to $6 trillion in 6 years' time. $6 trillion. So it's a clear and growing problem. So what do we need to do to address this? As we found with Mental Health First, not with Are You OK? And I think some of you may know that I was involved in helping to start that as a founding board director, is that simplicity works. And there's a lot of people that want to help, but they don't know how to. So the biggest and the fastest momentum in any organization is getting those people that do want to make a difference to train them and show them how they can do it. And that's where it all comes down to the managers and skill building for managers. So why are managers so important? Gallup estimate they contribute 70% to the engagement and the well-being of the team. They, having simple tools like moodometers can really help with understanding where people are, how they're going. But they can also, when we think about, what helps take us up the moodometer, in the workplace, we talk about a care first culture. And what that is where we practice self-care. And I love the example, I think it was Kate shared before, about asking what people are doing for their body, mind, and spirit, just encouraging that self-care, knowing what people like to do and encouraging them to do it. The crew care is how we work with each other. This is our psychological safety, our psychological health, our resilience. And then the third part is the red zone care, being able to identify those people that are struggling, catch them early. The greatest thing the greatest nirvana for mental healthy culture is prevention and early detection. And the red zone care is about early detection. If we get self-care and crew care right, we build growth. Crew care and red zone care right, we build resilience. And self-care and red zone care right, we reduce risk. So how do we make this happen? As I said, a lot I've learned from Are You OK has come over to our approach at We Care and how we do it. Simple cuts through in a very busy, very noisy, time poor situation. And the framework that we talk about within We Care is this I Care. This came from me surveying over 4,000 people to find out what worked best in their recovery. So I is how we identify someone who's struggling. C is for compassion and how we ask, are you okay, with empathy? And access experts, revitalizing work and exercise are encouraging people to take action. Accessing experts could be calling your EAP, seeing a psychologist. Revitalizing work is knowing that work is good for our recovery. We're better off in most situations to be connected with our workmates rather than being at home. There are exceptions to that, but in most situations that's the case. And finally, exercise. And within our We Care approach, that's the framework that we follow. Just because it's simple doesn't mean it's not robust. And, when we first started Are You OK, two of the largest mental health charities didn't want to be involved with Are You OK because we didn't have a psychologist or a psychiatrist on the board. We've since found out, and there is now robust proof, that social support around a person in distress is a proven reduction in suicidal ideation and suicide action. So, and likewise, with all these things we've highlighted, they have all shown to be very, very important for successful prevention and recovery in the workplace. We must also keep this in mind. For those of you that have done mental health first aid, it's a very good, very intensive course, goes for a couple of days, but it's hard to remember. And anything, no matter what sort of course we do, is hard to remember unless there is reinforced learning. So this is the science of learning, and we forget 75% if there is not spaced learning after it and encouragement to put knowledge into action. And this is our approach with We Care Manager, a program that we have which is designed to scale the ability of managers to lead mentally healthy teams. The first thing is to do a 50 minutes e-learning. And in this e-learning, you'll find that there's a case study in there that takes people through it. It goes in detail through the I Care framework. But most importantly, there are then 16 help sheets. And these are help sheets about how to find a mental health savvy GP, about how to prepare for a mental health discussion, about how to encourage someone to exercise when they don't feel like it, how to partner with someone to help them transition back to work. So these can be accessed at any time after you finish the course. And there's also a case study that goes through it as well, that shows someone who's been performing well suddenly burns out and is on stress leave, and what a manager can do practically to approach that person and move back. It's then followed by 12 nudge videos. And, I was talking with Caroline and Lance earlier today about the importance of having this spaced learning. So these are 2-minute videos that share a nugget from the course and encourage people to discuss that with their team and put it into action. So again, it's just sort of reinforcing and encouraging people to put it into action. And then the third element is the Momentum Toolkit. So this is a client team portal which contains videos, newsletter copy, help sheets, videos, et cetera, so that the project team can keep things going over time. And the mantra for any mental health program or any program whatsoever is it's got to be easily accessible, practical and ongoing. So easy to access on your phone or your laptop or your desktop, and then really, really practical. So it's very easy to access those help sheets on your phone, for example, and then email them directly from your phone to the person who you're trying to assist. So just looking at how to make it easier and simple as possible. Many organizations have lots of resources, EAP, manager assist, mental health first aid, but often it's hard for people to find. And the beauty of the way that we put together We Care 365 is that all those things are contained within there. So you have the EAP and manager assist numbers. You can list all the mental health first aiders you have. You can have all your support helplines, all those ones outside the organisation, and things related to diversity, inclusion, bullying, and harassment. So there's a number of people here on startups, and they, I'm involved in a startup, and they have, particular challenges. In the smaller business, you just have limited resources and financial pressures, and so it's important to think of ways that we can help startup founders to create the right culture in their organization. There's high workload and job demands, and there's real huge uncertainty and stability, often around finances and what have you. And, we've deliberately put this together, this program, so that anyone can access it. And we actually have, through EML, the workers' comp provider, you can actually access We Care, not We Care Manager, but you can access, if they are your provider and they provide, your workers' comp support, you can access these programs for free at their M-Learning portal. So if anyone doesn't know how to do that, please feel free to contact us afterwards and we'll share exactly how you can access. So everyone in New South Wales and Victoria, every little business can access it if they're connected with M-Learning. And this is how we typically launch it with, or the process for rolling it out. So we have people try. So we'll take them through a demo like this, then allow them to go away for a week or two and to experience We Care Manager themselves. I'm going to be showing you a demo in a moment. We then customize it. So we look at, including the photos that organization has, if they want to customize it. If you don't, it's good anyway in terms of providing this background. But some people want to have their own logo, their own style guide, their own colors, photos of their people in there. And that's eminently possible with the way we do it. I've got a checklist for you on how to launch it. We've got a building a mentally healthy culture checklist. So, it's very important to plan it well, but in particular to plan what happens after the launch. And because when you do that, you maximize the impact of it. So we're now just going to have a quick demo to show you, what it looks like and how that comes together. And Jenny, who is We Care 365's operations manager, she has great experience in this because she often helps groups to customize it as well. So just pass it over to you now, Jenny.
Thanks, Graham. So as Graham said before, this is the e-learning module which we're going to demonstrate, but it's important to remember that this is going to be bookmarked by the launch that you do internally, and we can help you with that. Our Momentum portal is full of good resources. And then when you finish the actual e-learning module, you begin a 12-week program of nudge videos. So that's once a week for 12 weeks, you're going to get an email with a 2-minute video, which just kind of helps cement that learning that you've been through. So the module I'm showing you here is one that we have actually customized for a client. It was actually AGL. Typically, our banner here is one that we just supply with generic photos, but in this instance, and quite often with clients, particularly if they have a diverse workforce, they will supply images of their own employees, so that when people are looking at the module, it kind of really reflects them and they can see themselves in it. We're going to start off with a welcome. We'll put in logos if you want that supplied. We have a quick quiz just to see how people are feeling before they start. And then we get into the module. And one of the things that we've done here, and we find this works really well, is that the client recorded a message from some of their leaders. And it just talks about why they're implementing We Care Manager into their organisation. They might talk a little bit about some of their own experiences with mental health issues and how they're really encouraging staff to take this on board. So I'm not going to show you that whole thing, but that's a great example of what people are doing. As we work through the module, we've got some quizzes and some sort of reflective answers for people to work through. Now, again, all these colours are our generic colours, but they can be customised using your branding. Pre-selected these would be embarrassing to get them wrong while we're in a demo. So we find that managers, we just have so much to do. You know, there's the organisation of the team, there's the leading, there's protecting, influencing, and it's just really important to incorporate the caring as well. So that's why we put this module together to help everybody. There's a lot to remember.
And Jen, if you just show the resources section, so this can be accessed at any time.
Yeah. So we have the Get Help and the resources, which are just sort of just-in-time resources, and anytime you need to refer to these, you can. So one of the things that we've done with this client, for example, the Get Help, in some cases it's a generic PDF, but in this case, it's going to link straight to their own resources. Obviously, we can't show you those because we can't log into their intranet, but we could have that logged into your intranet, or we can have our generic ones there. There's lots of other ones. If you have your own employee assistance program, we include that here. More worksheets, as Graham spoke about seeing a psychiatrist, finding a mentally health savvy GP, because not all GPs are created equal. We have found when it comes to identifying and helping with mental health problems. And in the Get Help section, there's some quick links that we can find also. So we work through here. We have some quizzes and things to do. And then in each section, there's a take action, and you can add this to your calendar, and that's going to pop up in a week's time or a day's time, whenever you set it, to remind you to do those actions that you thought about as you work through the module.
Just click it, Jenny, to show how that works.
And then you have to download to your calendar.
Mm.
In the common challenges, this is the case study that Graham talked about. So this takes you through the challenge that a manager might have when he has an employee, or he or she has an employee, of course, who may be acting in a way that's not typical for them. So identifying that, talking them through what's going on, and steering them to help. That shows you all the steps to take. And then there's some other interactive exercises to do. And the thing about this is that people just can't scroll through mindlessly. You have to actually click on the different sections and read through it before you can progress. Go through those.
Great, thanks, Jenny. Well, but you know, there's a lot of thought gone into turning knowledge into action. A lot of resources, not just ours, but some other great resources that we've come across Australia and around the world as well. Yeah, so if you wouldn't mind just closing down.
Thank you.
Excellent, thank you. And this is, I guess, what some people are already doing and working with. You know, we've been involved with quite a large number and diverse number of clients, and they've all, you know, most of these have gone through the customized stage, but we've also got a number of clients that just use the version that we have as well, because they're not large enough to justify that. You know, this is a great program that we've been working on with Audi, and they are currently rolling out WeCare Manager to their 2,500 plus managers in 550 locations. And the interesting thing is they've created two versions of the program for WeCare Manager. There's one for those in stores, and there's one for those that are in transport, warehouse, logistics, etc. They're rolling this out just now, and then in about 2 months' time, they're going to be rolling out as our second program, WeCare. So that's coming up in a pretty short period of time as well. We've had other, you know, clients like SPC. They've found that they are based in regional New South Wales, and they've had lots of issues. There's been bushfires, there's been floods, there's been, you know, difficulty with COVID and all this sort of stuff. And so many of the people found the programs were just as relevant for their personal life. And that's, I think, what we all have to encourage as well. This isn't just relevant for our work life, it's a life skill. And, you know, being able to create our private care crew is a really important thing to strive for as well. These are the things, you know, as I said, we've been inspired very much by Are You OK? To make it simple, easy to understand and insightful. It's jargon free. But, you know, there's been tremendous payoff. 92% of people having, this is the shorter WeCare course, 92% feel more confident. They're just in the process of rolling out WeCare Manager now, but with the WeCare, 92% feel more confident to support someone who is struggling. So, you know, how does this work? You know, for a one-time license, a one-year license for this program, it's $200. For a lifetime license, it's $370. So for, you know, small to medium businesses, this is still a very, very viable proposition. You know, for enterprise, you know, the largest one we've done so far is for Audi, and it becomes, you know, very, very reasonable in terms of pricing on a per manager or per employee basis. And, you know, we would really love to assist you in some way. And, you know, we're offering attendees today. If you know, 5 of you have already got a free one, so well done. But $100, you know, instead of the usual $200 for a year, $100 for you to experience it as well. We also have a building a mental healthy culture checklist, and that can be found at our website, wecare365.com.au. And if you feel that you would like your HR, WHS, your risk team to get a short demo of this, we do a demo in basically 30 minutes, and it shows them about it. So we will send you, as a follow-up to this, we'll be sending out the recording to this. We'll send out the recording of my interview on about the new legislation, the TV interview with the new legislation. And if people want something, you know, we'll provide a way for you to come back and ask and to find that out. So yeah, if you would like to make connections and move forward, please feel free to reach out to us. We do have some questions already that have come in, quite a few. In fact, we probably won't get through them all, but we said we'd finish at 2. We will finish at 2, but I'm happy to proceed if people have more questions to go on. So one of the questions here is managing compassion fatigue in healthcare with workforce shortages. It's a really big issue and it's a complex issue. And just having a weekend manager program won't do that. One of the really important things to stress in those situations is the importance of those workers to practice self-care. And, I have a separate program on self-care isn't selfish. We can't help others if we don't help ourselves. But this does allow, if a manager's in good shape, that does allow them to identify someone who's struggling, have that "are you okay" conversation. There's a question here. How do we make new behaviours stick? How to help change those less positive in this area? And, we've given a lot of thought about turning knowledge into action. My co-founder, Brendan Carter, his team is one of the best e-learning team in Australia. And all the programs are geared to try and turn that knowledge into action, being able to go from the course and put an appointment directly into your diary about when you want to discuss this. And it's been shown that if you do that, if you decide when you're going to do it, it increases the chance of you doing it by 300%. The actual thing that what appears in the diary as well is a description on that particular section. So if it's about identify, it has resources and information there about how to identify people, etc. Are there any inherent cultural, attitudinal blockers for leaders and managers that prevent fostering better mental health at work? Yes, there is. We are working with Aon in creating the Southeast Asian version of We Care Manager, and we've made a version in both Singapore and in China. And of course, the language has to be different. There has to be nuance in those discussions to make sure that it resonates with people. Also, all the images are changed to Asian faces and that type of thing. We've also got a partner in Canada who has launched it in that environment. And I think Canadians and Australians are quite close. But in Canada, it's a bilingual country. And so it had to be made available in French. And so that's happened as well. In Asia, we're going to be working towards providing a Mandarin version for clients up there. So you're absolute, and there is greater level of stigma in places like Korea, Japan, India. So yeah, we have to be aware of that. How do you ensure leadership buy-in? And that's, to us, that's the number one predictor of success, is having a senior leader, CEO, or a senior sponsor who's a divisional director or something to be the leader of that, to tell their story. We are encouraging leaders to tell their stories, and many, many people do have those stories. As I said, I'm going to be sharing on LinkedIn this afternoon a leader's storytelling playbook on how to do that. Any tips if an employee says they're fine and they aren't? And that comes from Chelsea. Yes, there is. I think there's a couple of things to do there. It's about revisiting it, saying, look, I know, you may not be ready to do, but do you mind if I revisit in a couple of weeks if I'm not concerned? So that's one thing you can do. The second thing you can do is to reach out to a colleague that could be struggling, or a colleague that knows that person better, that has a greater sense of trust with that person, and just say, look, I'm really worried about Todd. Would you mind having a conversation, just seeing if they're going okay, and ask them okay? So that's the second option. The third option, I think this is probably closest to the best, is admitting that you're struggling yourself with something, and to be authentic about that. Just, struggling with all these Zoom meetings or whatever it may be, and really feeling shot and burnt out at the end of the day. I'm finding it's hard to, recharge in the morning. So admitting yourself, showing vulnerability to yourself, and then inviting them, are you finding any of those issues? And there's a much, much greater chance of them admitting they're doing it if you are vulnerable first. If you've got any other questions that have come up now, please put them into the chat. We've still got a couple here, but we'll come to any specific questions that you want to answer. If you just put them in the chat. We're happy to hang around, so please feel free to do that. Another one here, this is from Verity from New South Wales Health. How to address reluctance to actively manage psychosocial risk in employee when evidence-based approaches don't cut through. Verity, one of the biggest things is getting that leadership buy-in. One of the biggest things is getting leaders to share their stories. One of the biggest things is showing how this isn't something extra. It relates to the vision and values of your organisation. So that's a really positive thing to do. I mentioned before about Emma Hogan. She's the Secretary of the New South Wales Customer Service, and that's an overarching division of about 22 different departments. But Emma speaks openly about her own struggles with mental health. And, she has been the most listened to podcast out of 46 that we've now done. And, I encourage you to listen to Emma Hogan to see how you can break through in large government departments. She's managed to do, no department is perfect by any means, but the intentions are there and there's certainly been progress. So just checking if there's any questions that have come in here now.
Nothing else at the moment, Graham.
Keep up. Okay, thanks, Mo. Great. There's still some more here, so I'll keep going for just a couple of minutes. This is from Melissa at the Gidget Foundation. How do we upskill managers? And I guess we've got a vested interest here, but make it easy for them to learn, make it easy for them to make a real difference. Are there analytics that tell us if the group or individual approaches to this is better? Not with our program, but there are some very, very interesting programs now that are able to automatically assess employees' mood by looking at what they post on Slack or Teams or emails. And it's like a spell check behind it. And it assesses a person's mood and then approaches that person confidentially and gives them hints or advice about what they could do. So we certainly don't have all the solutions, but we've got our finger on the pulse of lots of great developments that are happening in this space. Thank you all very much for taking out your time today. It's been great having you on board. And if we can help in any way, please feel free to reach out. Have a great rest of the Friday afternoon. Check out my LinkedIn post about what leaders can do and a leaders storytelling playbook. And we really look forward to helping you if we can in any way. All the best.
Thanks so much, Graham. Thanks for having me. Pleasure to reconnect.
No worries at all.
Bye.